I have been working in healthcare for over 30 years, and after treating thousands of elderly patients, I can guarantee one thing that will surprise you. Most of the tests your doctor orders after age 70 may be doing more harm than good. I'm not talking about medical negligence. I'm talking about a system that treats everyone the same, using the same protocols for a 40-year-old and an 85-year-old. And that is a very serious mistake, because after 70, your body functions differently. Your risks are different. And most importantly, what you need is not to live another 50 years, but to live well the next 10, 15, 20 years. However, there are tests that are expensive, cause unnecessary stress, lead to aggressive treatments, and ultimately do not improve your quality of life in any way. On the contrary, they can even make it worse. Last week, I received a 78-year-old patient in a panic because the doctor ordered a battery of tests and found abnormalities. She wasn't feeling anything, but now she was terrified, losing sleep, thinking she was going to die. When we analyzed calmly, we discovered that those tests were completely unnecessary for her age. If you are over 70 years old or care for someone in this age group, stay until the end of this video. I will reveal the 5 most requested tests that you should question, why they can be harmful, and most importantly, what to ask your doctor before undergoing them. And at the end, I will share the list of questions you should ask at every appointment to ensure that each test truly makes sense for you, not just for a generic protocol. So stay with me because this information can save you a lot of money, a lot of stress, and ensure that you focus on what really matters, living with quality. The first exam you should question: breast and prostate cancer screening. This is controversial, I know. But listen to me carefully. Annual mammograms for women over 75 and PSA tests for men over 70 are the most automatically requested exams. The doctor doesn't even ask, they just include it in the order. But here is the problem. Studies by the Brazilian Society of Geriatrics show that after age 75, routine screening for these cancers causes more harm than good. Why? First, these cancers grow very slowly at this age. You are much more likely to die from other causes than from the cancer that was found. Second, treatments are aggressive. Surgery, chemotherapy, radiotherapy in a body of 75, 80 years old can destroy your quality of life to treat something that perhaps would never have bothered you. Third, the tests generate many false positives. That change that appears leads to more tests, painful biopsies, terrible anxiety, and in the end, it was nothing. I had an 82-year-old patient who had routine PSA. It came back abnormal. They did a biopsy. They found a tiny cancer. They performed surgery. He became incontinent, lost his sexual function, and fell into deep depression. To treat a cancer that probably would never cause any symptoms. So here is what you should ask. Doctor, if this test finds something, will the treatment improve my quality of life or just prolong suffering? With my age and other conditions, do you really recommend this screening? If you have symptoms, pain, bleeding, a lump you felt, then yes, investigate. But blind screening after 75? Question it a lot. Second test, routine colonoscopy. Colonoscopy is excellent for younger people, but after age 75, especially if you've had normal colonoscopies before, it becomes high risk. The procedure requires sedation, which in the elderly can cause mental confusion for days. It requires aggressive bowel preparation, which can lead to dehydration and worsen other health conditions. And there is a risk of intestinal perforation, which can be fatal in an older person. Researchers from the Federal University of São Paulo followed 800 people over 75 who underwent routine colonoscopy. The result? Significant changes were found in only 3%, but 12% experienced procedure-related complications. In other words, for every person who benefited, 4 suffered harm. My clear advice is, if you are over 75 and have had normal colonoscopies in the last 10 years, strongly question the need to repeat it. If you've never had one, it might make sense to do it once, but not to keep repeating it. Ask like this: Doctor, considering my age and medical history, what are the real risks of this procedure compared to the benefits? Is there a less invasive alternative, such as a stool occult blood test? Because yes, there is an alternative. The stool occult blood test is much simpler, completely risk-free, and can indicate whether further investigation is needed. Test number 3. Repeated bone densitometry annually. This is a classic. The person undergoes densitometry, finds out they have osteopenia or osteoporosis, and then the doctor asks to repeat it every year. But here's the problem. Bone density does not change significantly from year to year. You might be taking calcium, vitamin D, exercising, and the densitometry will still show osteoporosis because bone does not rebuild quickly. This causes unnecessary anxiety, repeated expenses, and worse, it leads doctors to increase medication doses that have serious side effects. International guidelines recommend repeating densitometry only every 2 or 3 years in patients with osteoporosis and every 3 or 5 years in those with osteopenia. And there's more. After age 80, densitometry becomes even less important. What matters is not the bone density in the test, but preventing falls, because you can have dense bones and fall and break everything, or have osteoporosis and never break anything if you don't fall. A study from UNICAMP showed that investing in balance exercises prevents many more fractures than repeatedly doing densitometry and taking medications. Ask, Doctor, do I really need to repeat this exam every year? Will the result change any treatment? Or would it be better to focus on preventing falls with exercises and home adjustments? Most of the time, the second option is infinitely more effective. Exam number 4, the famous annual full checkup. This is the darling of laboratories. That package with 40, 50 different tests. Complete blood count, kidney function, liver function, thyroid, vitamins, minerals, cholesterol, everything you can imagine. It seems that the more tests, the healthier you are, right? Wrong. The problem with giant checkups is that they will always find some abnormality. Always. Because the human body is not a perfect machine. There are normal variations, fluctuations, small deviations that mean absolutely nothing. But when the doctor sees an abnormality on the report, they feel compelled to investigate. They order more tests, sometimes start treatments, and you enter into a spiral of unnecessary medicalization. I had a 76-year-old patient who had a complete checkup. A vitamin B12 level appeared to be at the lower limit. She had no symptoms, was active, lucid, healthy. But the doctor became concerned and ordered an endoscopy to investigate malabsorption. The endoscopy was normal, but she went through all that stress unnecessarily. After age 70, tests should be targeted. Do you have diabetes? Monitor blood glucose and HbA1c. Do you have a thyroid problem? Check TSH. Are you taking any medication that affects the kidneys? Check renal function. But ordering 50 tests on someone who is well creates problems where none exist. Ask, Doctor, which tests are you specifically requesting for my conditions? Can we focus only on what truly impacts my treatment? Less is more. Targeted tests are more efficient and cause less anxiety. Test number 5. Advanced cardiac tests in asymptomatic individuals. Exercise stress test, scintigraphy, catheterization, cardiac resonance. These tests are fantastic when you have symptoms: chest pain, shortness of breath, palpitations. But ordering these tests for someone aged 75, 80 who feels nothing just because it's good to prevent is a shot in the foot. Why? Because these tests almost always find some abnormality. At 75, everyone has some degree of coronary artery disease, some artery more narrowed, some scar in the heart. It's expected, part of aging. The problem is that finding these abnormalities leads to aggressive treatments. Bypass surgeries, angioplasties, stents. Procedures with very high risk in the elderly. A study published in the journal Circulation followed 1,500 people over 75 without cardiac symptoms. Half underwent advanced preventive tests, and half did nothing. The result? After 5 years, there was no difference in mortality between the groups. However, the group that had the tests experienced 3 times more surgical complications. If you have no symptoms, continuing your medications, controlling blood pressure and diabetes, and walking regularly is infinitely safer than seeking out problems. Ask, "Doctor, am I experiencing any symptoms that justify this test, or is it just preventive? Because if I am well, I prefer to avoid risky procedures." The best cardiac test is being able to climb a flight of stairs without getting too tired. If you can, that's a great sign. Now that you know the 5 tests to question, I will give you the definitive protocol, the questions you must ask before any test after age 70. First question: what will this test change in my treatment? Will it make me take any new medication or undergo any procedure? If the answer is no, do not perform the test. Second question: what are the risks of this test? Is there any preparation needed? Is sedation involved? Can it cause complications? If the risks outweigh the benefits, question it. Third question: is there a simpler and less invasive alternative? Often there is, but the doctor might not consider it because it's not the standard protocol. Fourth question: if I don't take this test and continue as I am, what are the real chances of something bad happening? This is the most important question of all, because it makes you think about what truly matters. Look, I'm not telling you never to have tests. I'm telling you to be an active patient, not a passive one. Question respectfully, but always question. Because after 70, the goal is not to have all tests perfect. It is to live well, with autonomy, without fear, without spending money and energy on things that won't help you. If this content made sense to you, I have 2 requests. First, share this video with someone over 70 whom you love. It could be your parents, your grandparents, that dear neighbor, because this information can prevent a lot of unnecessary suffering. Second, write in the comments the phrase, "My health, my choices." It's not just a comment, it's a commitment you're making to be the protagonist of your own health, not just a follower of protocols. Because the truth is this: your body, your rules. You have the right to question, understand, and choose what makes sense for you. Hugs, and see you in the next video.